Hello, Global Animal Health Nation. Welcome to our interview series, where we will be showcasing the stories of the movers, shakers, and history makers all over the world doing big things in the animal health community. Today, we will be visiting with a veterinarian turned One Health expert, all the way from Washington, D.C., who shares with us how a chance teaching job at a middle school catapulted her to serving as a One Health key opinion leader on Capitol Hill. Through her experience, she is now enabling and impacting hundreds of others by creating One Health curriculum plans and outlining her lessons learned in her book, The Art of Science Communications, sharing knowledge with students, the public, and policymakers. Her story just goes to show that a veterinarian's work is not done just inside a clinic, but also has the ability to mold the future of the next generation decision makers and the animal health industry. Let's learn more about her story. So today I'm really excited to be showing a super exclusive guest that we are having on the show. Not only is she the first veterinarian we're interviewing, but she's also the first interview that we're doing with an expert in One Health, which, as we all know, is the intersection of animal health and human health and has really become a topic of interest for pretty much everyone around the world, but specifically in life sciences, due to the outbreak of coronavirus. So today we'll be speaking with Dr. Deborah Thomson. She is the author of The Art of Science Communication, and really it's her mission to share knowledge with students and the public and policymakers truly about effective communication of science. So Deborah, thank you very much for joining us, and let's just jump right into it. Tell us about yourself, your background, education, and a little bit about your career path.
Well, thanks so much, Amanda, for inviting me here. And it's such an honor to be the first veterinarian.
Yeah.
So exciting. I've been looking forward to this conversation. My gosh, my career path. It's been a jungle gym and not a ladder. I'll say it like that.
That's great.
My friends are like, Deb, you've really been all over the place. So let's review a little bit. So when I have 2 bachelor's degrees, one is in music, the other is in science.
Wow.
Because that makes sense. And at that point, I was also working as a professional musician, doing wedding gigs, reception gigs, things like that. And I was also teaching children in primary school music. From there, I applied to vet school. Even with 2 degrees, I did not get in the first time because that's time. So instead, what I used that 1-year gap for is I actually was teaching in a middle school, and I loved it. I was teaching English language learners in a middle school in Quebec, in Canada, and they were all francophone. They were all French-speaking kids, and I loved it. But I never forgot my passion for veterinary medicine. The way I see veterinarians, and the reason why I wanted to be a veterinarian was because I saw that it wasn't just helping the animals in front of you, it was helping the people who are relying on those animals. So I applied again, and fortunately I got in.
Wow.
So I moved from Canada back to the United States, and I attended Tufts Veterinary School. And in addition to getting a DVM, a Doctor of Veterinary Medicine degree, I also got a certificate of International Veterinary Medicine, which is, in retrospect, probably one of the first One Health programs there was in the world. But it wasn't called that then, because nothing was called really One Health then. Right. So you hit the nail on the head when you were talking about One Health. One Health, just for the the benefit of the audience, it's the interconnection between our health and the health of animals, the environment, plants, everything. A sick environment can cause sick people, can cause sick animals, which then can cause sick people. So everything's connected, right? It's a holistic view. In addition, the One Health approach is teamwork between people of different backgrounds, strengths, skills, and we come together and contribute to solving and preventing hard health problems. So when I finished veterinary school, I did an internship. If your audience has lived through an internship, you all understand why I'm laughing, because that was a tough year. It was like 80, 90-hour work weeks, right? I think my longest shift was like 26 hours. Yeah, it was a good learning experience. I'll say it like that. And then after that, I was going into clinical medicine. But I never forgot my love for teaching and my love for One Health. So after doing my 10 to 12-hour shifts, I go home and create lessons for kids about One Health. And that's the way I could relax. And on my days off, I went into classrooms and I taught about One Health. So from there, I had the opportunity to be a volunteer with the California Veterinary Medical Reserve Corps. And in 2018, there was a state emergency with the wildfires. It was a life-changing experience. I actually wrote an article about it that was published. But that experience made me realize that I wanted to, yes, help families, but I also, with the power of a DVM degree, I could even influence policy and actually think of the world in a bigger way. My world, my bubble, I expanded it. So I applied for the American Veterinary Medical Association's Congressional Fellowship. That's supposed to be in policy, and I was fortunate enough to get it. That year they only selected one, and I was shocked when I got it, but man, was I grateful.
Let's talk a little bit more about your book. So you specifically mentioned when we talked prior to this that you intentionally made it a short read because you wanted it to be condensed and concise and to the point. So just tell us a little bit more about how you thought about putting the book together, the framework around it, and who your target audience would be.
Right. The target audience would be aspiring and professional clinicians, scientists, engineers, anybody in STEM, science, technology, engineering, mathematics, or even STEAM with the arts there. But there's a large section in the book that's dedicated to communicating science and medicine with the public. And these are things that I have learned along the way in my career. And when I see new graduates, because I still work in the clinics on occasion, and I see new graduates explain, say, kidney problems and saying renal instead of kidney, it's like, okay, there's a step there. We need to bridge, It's just because it's a whole new language that we learn in medicine. And we do it because it's shortcuts for us. We can communicate really efficiently that way, but it's another language and we have to appreciate that. So communication is really key. And the book is talking about lessons learned throughout my career so far in how to improve communication for clients and the general public.
If somebody was wanting to learn more or have access to your book, I know you mentioned Amazon, but where could someone come to either speak with you? I know you said you might be doing speakings as well, but tell me a little bit about if someone wanted to learn more about you or your book, where should they go?
Thanks. So I have a website. It's Deborah-Thomson, THOMSON.com. And there's an area where you can request availability, and therefore I could go and talk to a school, I can talk to a conference, talk to a company. it also lists all of the different subjects and places around the world where I've been fortunate enough to speak at, as well as some endorsements. And most importantly, it talks about the book and how you can order the book.
Dr. Thompson, thank you so much for your time today. I was so excited to talk to you. I'll make sure to attach all your information so that anyone who listens to this and wants to learn more can get in contact with you. And thanks for just being a trailblazer. I really am looking forward to following up with you and tracking your success further on. And we'll definitely keep up with you and through the Global Animal Health Network and be posting about you. So thank you, Dr. Thompson.
Thank you, Amanda. This has been fantastic.